All right, everybody. Now it's time for scrubbing. Okay. What I'm going to show you is the way I've been taught. Well, let me preempt this by saying, scrubbing has changed a lot over the years. When I was first learned how to scrub, I won't tell you which year, but anyway, I had to scrub for 10 minutes. That's most of the older doctors will tell you that was the way it used to be, 10 minutes. Now it's a 5-minute scrub. The first scrub of the day is 5 minutes. After that, the rest of the scrub should be about 3 minutes, but the first one should be about 5 minutes. So before I scrub, the first thing I'm going to do, remember we talked about jewelry, I'm going to make sure all of my jewelry is off. I'm not going to wear a mask during this part because I want you to be able to understand everything I'm saying. So like I said, I take my jewelry, if I have rings or whatever, and I take it and I put it in my top pocket, or I put it in my bottom pocket, wherever is most comfortable, and I know I won't lose it. Okay? That's number one. The second thing I'm going to do is I'm going to pick a brush to use. We have 3 kinds of scrub brushes. We have hexachlorophene, we have betadine, and we have a new one that it just came out, I just saw it, and it's this one right here. I'm going to just show you. It's a very light blue, and this I think is for people that have problems like with sensitive skin, and they have this for them. And all these, of course, are latex free. Okay. So once I've picked out my brush, if you're doing orthopedics, like you're doing implantations like total hips, total knees, if you're doing in urology where they do a lot of penile prosthesis, the scrub brush I like you really to use is the betadine. Okay, but otherwise most people, myself included, I use hexachlorophene. Okay, so the first thing I'm going to do, and before I go on to that, I'm going to talk about one other thing, is there's a little thing that I know you've all seen, it's called Avogard. I'm going to show you that right here, Avogard. I don't want to see any medical students using Avogard, and let me tell you why. If you're using Avogard, that means you haven't even learned really how to do a proper scrub. It's very important for you to know how to do a proper scrub. The reason for Avogard is really, if you in numerous cases, you do your first correct scrub, and then to move things along, the Avogard. This is based on friction. Scrubbing is not based on friction. It's based on soap and water. Okay. So if you're 4th year, it's okay. 3rd years, I like to see all of you really using scrubbing all the time. Okay. Unless it's an emergency, of course, you have to get right in there. Then I'll look the other way when you use Avogard. Okay. So we've picked out our brush. As I said, I'm going to use a hexachlorophene brush. The first thing I'm going to do is I'm going to get my brush ready. I'm going to open it up. All right, don't laugh. I'm opening it up, okay? And I'm putting it right here. It's ready for me to use, okay? It's called degreasing. What that means is it's like just getting off like the basic oils off your skin. Every sink has soap at the sink side. Okay, so the first thing you want to do is take a little soap. This one happens to have where it's operated by the knee of this sink. Some of ours have buttons. It just depends where you are. I'm going to take a little water, and of course I'm going to turn the water off as I'm doing this because we are green here in Tulane. We want to save water. Okay, so I'm going to go ahead and I'm going to just degrease, just like so. And when I take this off, I'm going to run my hand in an upward position. Why do I do that? Because I want all the water to flow downward to get it off. Okay? I do it with the second hand, same thing. I'm going to shake that up a little bit. I'm going to turn this off. Okay? Next thing that we do, and this is all on your operating room paper, is I'm going to clean my nails. If you use Avogard, you have to clean your nails too. So that's the next thing we do. We clean every nail bed. And I know some of you, this part is a little difficult if you have no nails. Okay? But you clean every nail bed out. All right? And that's what I'm doing here. Now, in the interest of time, I'm not going to do both my hands, but I'm going to go ahead and show you. And I'm going to throw this in the correct receptacle, which is not the sink, but I'm doing that today. Okay. Third thing we're going to do is we're going to get our brush nice and soapy up. Okay? Now, like I said, you want to turn that water off, because what happens when warm water is running constantly? You have to go to the bathroom. So you do not want to start this process and have to stop and have to go to the bathroom. So turn the water off, being green and conservative, and you're going to start. The first thing to do a proper scrub, it's about on the hand area, because that's a part that's close enough to the body, close enough, excuse me, to the surgical area, is 40 strokes, approximately 40 strokes. That means, and we start with our fingernails first. I'm going to show you. I'm going to do one whole arm. Now you'll see different people doing different things. Some people will do the hand, the arm. I think it's best really to do one whole side and do the other side, okay? So I'm going to go ahead and I'm going to start my briskly. Now everybody, not slow, briskly I'm going to be scrubbing my fingernails. Now how do I know I've done 40 strokes? One of the residents gave me a little tip which I thought was very good, and I'll pass it on to you. Count to 5. Not 1, 2, 3, 4, 5, but 1, 2, 3, 4, 5. When you say that fifth number, you'll have done about 40 strokes, okay? After we do that, we start on the outside of the hand, 40 strokes. We move into the inside, 40 strokes, 40. Every aspect of the hand must be done, of the fingers, 40 strokes, okay? And then I usually do my palm nets, and as you see, I am using the brush part of the sponge. I do this briskly 40 times, and then 40 times on the top. Okay, now I'm ready to go up the arm. Another resident gave me a very nice tip. Normally what you should be doing, and this is the way I've taught it in the past, is you work your way up the arm. On the arm it's a 20 to 30 strokes. So for that I usually count 3. I just say 1, 2, 3. However, one of the residents told me that the longer the hexachlorophene, if you're using that, stays on your skin, the better it is. So what we do now is I just do lightly, I give a couple brushes up, and then I start the process. So that way the soap has stayed on my arms a lot longer, and I get a better sterilization. Remember, nothing is actually really sterile. We are just meeting the sterile criteria. That's what sterility really means, that you are meeting sterile criteria, whatever that happens to be, with flashing or whatever. So that's what we do. Remember, we only go to 1 inch above the elbow. That's why you can't have long sleeves on, or this. That's why you have to wear appropriate size scrubs too. You want to go 1 inch above the elbow. Now say I'm scrubbing right here and I'm talking. My friend Robin, she's at the next scrub sink. Oops! She had me laughing. I dropped the sponge. What do? Well, if I don't have anybody, a good Samaritan coming by, I'm going to have to start all over. Okay. The same is said too, is if you're scrubbing and you're not paying attention and you hit something, you have to start all over. Okay. If you drop the sponge, and there's nobody that you have to get a brand new sponge. Okay. So again, 40 strokes on the tips, on all aspects of the fingers, the palms, and the top of the hand. Approximately 30 strokes going down to 1 inch above the elbow. Okay? I completed this one, and I do the next one. Okay? When I'm finished, I throw that in the appropriate receptacle, which is usually red, and then I'm going to, what I do is I kind of squish my fingers like such, so I want to get as much of this soap up as possible. Because let me tell you something. It's very hard to get your gloves on if you don't wipe your hands properly and you've got soap all over. So, I've done that. Remember, I'm going in an upward motion to get the water going down. Okay? So now we're ready to gown and glove.